Hey guys, Dr. Kilfoil here with Podiatry Explained. Just want to bring you another video of Onychodebridement. This patient, believe it or not, these are only 10 months old. This patient was just here in August of 2021. Unless there was some kind of mistake in my charting, this patient just let him go for about 10 months, and this is how long they are. This is incredibly long for 10 months. There's a significant fungal infection here. Let's get started. Welcome. All right, so here we go. You can see this patient's got some long ones. I had some requests. They want to see before and after pictures of something like this. So this is, relatively rare for me. Maybe I'll get one or two of these a week where it's this bad. It's I'm actually sweating. The AC system broke, and we're waiting for it to be fixed. Go figure, there's actually an AC company in the same building as me, but the landlord doesn't want to use them. He's too expensive. Anyway, so you're gonna see me sweat a little bit. It's gonna take a little bit of effort. Just watch and enjoy. So one of the dangers of doing this is that sometimes when a patient waits a very long time for their nails to grow, to get their nails cut or to cut their own nails, the skin will follow the nail up as it grows out. So as you cut it, you might actually accidentally cut some skin, and that skin, is going to bleed and it's going to hurt. So, the patient's not going to come back. For practice management purposes, you should avoid cutting your patient. If these were any harder, then I would probably use the burr to kind of score the area. I've talked about this in my last Onychodebridement video. I do a little twirl with my nippers. Show off. So that crap that's underneath this nail, we call it subungual debris. It pretty much just is a bunch of fungal hypha. I will get a close-up of that image for you if you'd like. It is just stacks on stacks and stacks of fungus. So Mr. and Mrs. Jones both came in together. They both had their last Onychodebridement within the last, since August of last year. It is June this year. I recorded the video of Mrs. and her name is not Jones, I know, but and then when Mr. took his feet out, I'm like, okay, I got to do this again. This is the one that counts. The other one was pretty bad too, but this one counts. One of the jokes I like to say to these patients when I'm doing it is like, oh, we should have weighed you beforehand so we could find out how much weight you lost. It usually gives a rise. And then I ask them if they could please come back within 2 or 3 months or 10,000 miles, whichever comes first. That usually gets a laugh too. All right, so the nipping is done. Now it is time to use the burr. So there's a vacuum attached to this burr. I turn up to full speed. This burr is my new favorite burr. It's a pear-shaped burr. The pear-shaped burr has a narrower end, so I can get into the edges a little bit better. It's not as aggressive as the ones with a wider diameter, but it's just a little bit extra time. It's worth it for me to get the accuracy and a little bit less aggression. Or the grit is a little bit finer. I feel like the end product is better. Honestly, there's a lot of podiatrists who don't do this kind of stuff, and I don't blame them. It's not the most lucrative thing. I just hate sitting around not doing anything. So these patients fill up my day. I'm happy to just do work. Because if I'm not doing these kind of patients, somebody else is gonna do it, and they're gonna be making the money, and I'm just gonna be sitting here scrolling around on YouTube. And I do that too much already. Fortunately, I had my music on in my exam rooms with copyrighted music, so we can't really listen to what's going on in the room. Otherwise, I'll get flagged. But it is, I think it's Fleetwood Mac, Dreams by Fleetwood Mac. You just imagine that score. Yeah. Now, since the pandy, I've worn a mask, And I'll tell you what, I'm gonna keep wearing my mask if these kind of patients keep coming in, because there's crap flying everywhere. And at least it's not gonna be socially, you know, I'm not gonna be socially ostracized for wearing a mask now. Now this nail here on the right hallux is so soft all the way to the back. Off camera, after we stopped recording, I felt like I needed to touch it up some more, and then the rest of it just fell apart. This guy, you know, we pretty much did an avulsion of his right hallux without having to use any local anesthetic. That thing just was mush. I'm sorry if my hands are covering a lot of what I'm doing, but I tell you what, I need to make sure that burr doesn't like flip around and hurt the patient. So I grip the toes and polish the nails like a freaking pedicurist. Most humbling thing that we do. Whatever, pays the bills, keeps the lights on. I learned that line from Dr. Thomas DeLauro, who's now retired. He's a great teacher at New York College of Podiatric Medicine. Dr. DeLauro is huge influence on hundreds and hundreds of students. He probably has, he probably doesn't even know how influential he was to a lot of people like me. Guys, thanks for watching. Like and subscribe. Just, hit the notification bell if you want to be updated on any of our new uploads. We're trying to put new stuff together every single day. This place is so hot, the AC is broken. Just future Roger, don't let that happen again. All right. Remember, every day is the best day of your life.